Augusta Health is an independent 255-bed community hospital in the Shenandoah Valley. We provide a wide range of services here, from surgical to pediatric to obstetric, gynecologic, psychiatric, and a broad range of medical and medical subspecialty services.
A key element that every hospital CIO faces is the need to protect the confidential information of our patients. As a result of that, we put a number of barriers in place to using our systems. We want our users to have long passwords. We want a two-factor identification if we can. The physicians have, for a long time, seen information technology not as their friend, but as their foe. We needed to turn that upside down. And the way we do that is by using technology to reduce the barriers, but at the same time improve security. And that's what we've been able to accomplish with Imprivata. If we look at the amount of time we were using a year ago for our providers, nurses and physicians, to log in and log out of systems, physicians routinely would complain about what it took to use our systems.
Particularly in the emergency department setting, we are in and out of our rooms a lot. We have to multitask. We go from one room to the next, and it was just a tremendous amount of manual intervention, and it just created a lot of wasted time and inefficiency when we're already pressed for time.
Strategically, we were facing this contradiction, the need to keep our information secure, but at the same time make accessing our technology simple and transparent. So it rapidly became apparent that a single sign-on process would alleviate and be a win-win for us and alleviate a lot of these issues that we were facing. So we started looking at various vendors for single sign-on, and we invited them to come and demonstrate their products. Imprivata came on site, and within a half hour of setting up equipment, had a working environment that they could demonstrate that was functioning on our systems and in our environment. That was very impressive for us.
The new Imprivata system we're so much more efficient in many ways. First of all it takes to get into the computer system is basically a tap with your badge. And it doesn't matter whether you're trying to get to the desktop or trying to get to the EMR, it's a single tap. And then the same to leave the system is a single tap.
The physician being able to get to where they need to place the orders and do the documentation is more readily accessed by the badge-in process and the single sign-on.
They will come in and establish a desktop. They will come in with their badge and get a desktop first thing in the morning. It will ask them both for the badge and for a PIN for the second factor authentication. After that initial setup, which takes about 15 seconds, their environment is established for the day. They now can go to any device, badge in, and in about a few seconds be back to the same screen that they just left. No more navigation, no more needing to go find that patient record. So if I take what used to be a 1-minute process each time they logged in and translate that into the average 5 to 10 second process that a nurse now uses with Imprivata, if we realized the nurse was doing this process 30 or 40 times each 8-hour shift, and then think of the hundreds of nurses we have working at any given time, 24 hours a day, 7 days a week. And pretty soon the savings adds up to hours and days.
Doctors who were late adopters of using the computer at all would see their colleagues go into devices, badging in and being right where they needed to be with no typing. And then even those late adopters would start calling up the IT department, emailing me saying, hey, how do I get my badge set up to do that?
When I arrived at Augusta Health 3 years ago, the workstation analysts that I employ within the IT department had a room that was chock full of hardware, floor to ceiling, piles of computer parts. And I had staff that were pulling apart computers and working on circuit boards. Very expensive and relatively inefficient, and we knew we needed to move in a new direction and to reduce our overhead and our cost structure. So we decided to move towards thin clients. I had used them successfully in other environments, and we had started to use it here, but it had not been fully rolled out. We have gone in that direction, and since that day we have not purchased any further microcomputers. We, bringing new technology into the organization, will trial that technology in the IT department first. It's our philosophy that we need to experience the pain before we ask our customers to adopt new technology. So we trial it in IT, make sure that we have a proof of concept. Then we roll it out to a single unit. This is what we did with the Imprivata. And we had a single floor of nurses who were willing to be our guinea pigs, and they piloted the product for about 30 days. At the end of that, it was so successful that other floors, other nurses were asking, when is it our turn? So we did a big bang approach after that first 30-day and implemented it across all the rest of our inpatient units.
If a fact client required replacing, if it died for any reason, our staff would have to know where in the hospital it was located, what kind of application base and what kind of applications were installed, and then after putting that very specific image on that device for that particular workflow, there was always continued troubleshooting because of the nature of a fresh install. Now if a device fails, they just go out and swap out a thin client. Since all the applications are now back in the server in the data center, all they have to do is configure it for the appropriate policies based on the area of the hospital that we've designated, and the configuration is instantaneous. To replace a desktop now, or an endpoint now, it's a 30-minute swap out of a thin client, whereas in past, a fat PC, a desktop computer, could take up to several days from start to finish.
If we had not moved to the thin client environment, I would estimate at least 25% more workstation analysts to maintain the PC environment that we had. We use a thin client today that is directly attached to the monitor, so it's a single footprint for our users. It's neat, it's tidy. As we move forward, we would be very interested in utilizing a zero footprint client in which the client is embedded in the monitor. So that is something that we're routinely looking for. And at the same time, having the XP embedded and continuing to have those devices work with Imprivata is fundamental. We want to continue to develop that environment so that we're using thin clients in business office environments. Locations where users are assigned to a specific device and want to be able to customize it the same as they can with their PC today. So we're looking to go into XenDesktop in order to allow that user to set up the background they have on their screen, or how they like Microsoft Outlook to present their email, for instance. We need to give them that PC-like experience, and XenDesktop will help us to do that.
One of the things that I've noticed is that on the floors we predominantly have thin clients now with Imprivata single sign-ons, and as you look around the units, you'll see that there's still a couple of fat client, old-fashioned desktop computers that we have for redundancy's sake that often aren't connected to the Imprivata badge-in process. And providers tend to steer away from those and look for the little red lights on the Imprivata badge-in. So it's very easy to see that this has been automatically and intrinsically adopted just by virtue of it being easier than logging into a computer the old-fashioned way.
Our latest endeavor is to speed up the amount of time that physicians are spending doing documentation. And to that end, we want to use our system to do physician electronic documentation. But the template process for physicians is always limiting. There's always a need to provide further color on a patient's care. So the physicians are saying, it's not enough just to have templates. I need to be able to have narrative. And that's the value of being able to dictate. We are establishing specific physician dictation points, dual screens with the microphone embedded on the unit, and setting them up specifically as the nuanced dragon dictation stations for doctors to use. So every floor and in their lounge and in their offices, they will find these dictation stations. We have used LDAP to identify the user and tie them to their voice file in the enterprise version. Any physician can come to any one of those stations and have their voice file automatically come up. So they only need to sit down, badge in, pick up the microphone, go to the particular template that they want to fill in, and they're ready to go.
New paragraph. I reviewed his electronic medical record and saw that he had a cholecystectomy in 2007 period. It also required an ERCP with sphincterotomy afterwards, period. So the voice recognition is a nice component of this. It definitely spares me from doing any typing, lets me preserve the clinical narrative here.
In our environment, Dragon recognition is actually occurring on the Citrix server, not on the local device. So we're able to use low-cost, thin clients to pass through the voice file to the high-end, powerful Dragon servers sit in the Citrix environment. As a result, we get extremely fast recognition and a very high level of reliability.
One of the hurdles to adopting computerized provider order entry is that physicians sometimes ask, I'm doing this for the system, what is the system doing back for me? And when the physicians saw that the IT department was introducing this badge-in system with the ability to do single sign-on, they could feel that the system was leaning back towards them, trying to make it as easy as possible. The Imprivata system was a visible, tangible, and very functional demonstration that the hospital was trying to help providers.
At the end of 12 months of implementation, we have achieved a 75% utilization rate of CPOE for all inpatient orders.
Oh, if we had to go back, yeah, I'd be looking for some new staff if we went back to the way we did it before. Once you get used to something that works, you don't want to mess with that.
After 12 months of use of single sign-on with Imprivata, it is taken for granted as much as we assume the telephone will work. There is an assumption by my providers that Imprivata will work every day, every time.